12 Natural Remedies PCOS. Number 1. Burdock. Burdock root acts on the spleen and the liver and helps to keep our body healthy. Burdock root regulates the secretion of estrogen and progesterone, which in turn cures the hormonal imbalance, which is the main reason for PCOS. It is also supportive of balanced blood sugar levels and cleansing for the entire body, especially where congested tissues and organs are present. Burdock root can either be consumed as a concoction, taken as tea, or eaten as a raw root in smaller quantities in order to provide relief from irregular periods and menstrual cramps. Number 2. Spearmint. Spearmint may help with your PCOS symptoms by normalizing the hormones in your body. It has significant anti-androgen effects which could improve hirsutism, unwanted hair growth, and acne in women with polycystic ovarian syndrome. Number 3. Chasteberry, Vitex. Chasteberry, Vitex, increases progesterone levels by increasing LH, luteinizing hormone levels, and it suppresses prolactin levels. The result is increased ovulatory cycles. This sounds like a perfect scenario for someone experiencing PCOS, but there's an issue. Vitex can actually worsen PCOS for some because their LH levels are already high, due to insulin resistant. Once you are already aware of your high level of LH, try and avoid the use of Vitex. If you have PCOS with normal LH levels and high prolactin levels, you might consider using Vitex. This kind of PCOS has a different root cause, usually inflammation from allergens like dairy and gluten, or as the result of using the birth control pill. Number 4. White peony. White peony contains a constituent called peonyflorin, which has been shown to reduce testosterone produced by the ovaries by converting testosterone into estrogen. It is generally used for infertility associated with PCOS, hyperprolactinemia, endometriosis, ovarian failure, and androgen excess. Peony has been shown to positively influence low progesterone, reduce elevated androgens, testosterone, and modulate estrogen and prolactin. Pairing white peony and licorice makes a great combination of herbs for PCOS to help boost ovulation due to the testosterone-lowering effects. Number 5. Licorice. Licorice root helps to maintain proper hormone production and release. It also supports healthy insulin levels and liver health for hormonal balance support. Licorice could decrease serum testosterone in PCOS women, indicating that licorice has an anti-testosterone activity that may be beneficial in treating women with PCOS. Number 6. Cinnamon. Cinnamon is extremely useful for women with insulin resistance by helping to balance blood sugar levels. It may also support weight loss, period cramps, improve ovulation, decrease hirsutism, and may play a role in lowering androgen levels. Cinnamon contains a natural chemical called cinnamaldehyde which increases progesterone and decreases testosterone production and balances out hormone levels naturally. Cinnamon may help restore menstrual cycles and also help to slow heavy menstrual bleeding caused by endometrial hyperplasia, thickening of the uterine lining, associated with PCOS. Number 7. Saw palmetto. Saw palmetto has been found to inhibit DHT production by reducing 5-alpha reductase production, which may help prevent hirsutism, excessive body hair growth, thinning hair on head, in women with PCOS. DHT is the androgen that enhances the effects of testosterone. DHT can cause PCOS symptoms like hair loss, facial hair growth, acne, and menstrual irregularities. Inhibiting this conversion of testosterone to DHT can help reduce the intensity of PCOS symptoms. This herb also helps to reduce endometrial hyperplasia and hormonal acne symptoms. It may also help regulate estrogen in women with estrogen dominance. Number 8. Gymnema sylvestre. This herb is known as the destroyer of sugar. It supports healthy blood sugar levels, controlling insulin, and helps curb sugar cravings. High blood glucose levels in women may contribute to hormonal imbalance. High blood glucose levels in women with insulin-resistant PCOS can prevent an embryo from implanting in the uterus. These conditions may cause a miscarriage before the woman even knows she is pregnant. Gymnema has been shown to control and lower blood glucose levels without lowering it below normal levels. This is beneficial for women with insulin-related PCOS. Number 9. Maca. Maca may help to increase progesterone levels in women. Maca works to balance estrogen and progesterone in the body, for a healthy menstrual cycle. Maca is considered an adaptogen or commonly referred to as an adaptogenic herb. Adaptogens are supposed to bring balance in the hypothalamic, pituitary, and adrenal glands. In addition, adaptogens like maca powder are supposed to help the body adapt and cope with stress and regulate the body's stress response system. They help the body by bringing it back into balance when the body either over or under produces hormones. So, the major goal here is to make sure the hypothalamus, pituitary, and adrenal glands function well. If they do, the effects of PCOS can be lessened. Number 10. Black cohosh. Black cohosh is an effective natural remedy for stimulating ovulation in women with PCOS. Study concludes that black cohosh can be used as a natural alternative to the prescription drug Clomid, clomiphene citrate. Some women with PCOS tend to have higher levels of LH, luteinizing hormone. And when LH is high, that triggers the body to produce more androgens and more estrogen, which invariably interferes with ovulation. One way of counteracting this imbalance is to increase progesterone, which black cohosh happens to do quite well. It has anti-androgenic effects which help to cure hirsutism and ideal for removing facial hairs. Given that black cohosh shows the ability to thicken the endometrium, it's a natural remedy that can help you when trying to conceive with PCOS. Number 11. Ashwagandha. Ashwagandha powder is one such Ayurvedic herb which has been traditionally known to be a powerful adaptogen. Adaptogen herbs help to aid the body in balancing hormones, which could in turn alleviate stress and symptoms of PCOS. Cortisol levels increase during stress. The stress hormone cortisol in turn reduces progesterone levels and negatively impacts fertility and healthy menstruation cycles. By regulating the stress response and nourishing the endocrine system, ovaries, thyroid, adrenals, ashwagandha powder helps to combat several PCOS-related symptoms such as fatigue, increase stamina, decrease anxiety, balance blood sugar and mood swings, improve sleep, hormone production and libido. Number 12. Tribulus. Tribulus is an effective, overall female fertility tonic and ovarian stimulant, making it an excellent choice for women with PCOS. This is especially true for women who are not ovulating due to PCOS. It has demonstrated the ability to increase follicle-stimulating hormone, FSH levels, and promotes regular ovulation and may reduce ovarian cysts in women with PCOS. Thanks for watching. And do not forget to subscribe to our YouTube channel for more videos.